There were too many legal issues or even perceptions of legal issues with employers incentivizing their employees to not have diabetes anymore. Something that I didn't do as a founder that I should have done is figure out a way to tell my story better.
That's product market fit.
Product market fit.
Product market fit.
I called it the product market fit question.
Product market fit.
Product market fit.
Product market fit.
Product market fit.
I mean, the name of the show is Product Market Fit.
Do you think the Product Market Fit show has product market fit? Because if you do, then there's something you just have to do. You have to take out your phone. You have to leave the show 5 stars. It lets us reach more founders and it lets us get better guests. Thank you.
Mary Beth, welcome to the show.
Thanks for having me.
So you started a company called Healthiby back in like 2018, 2019. You ran it for 4 or 5 years. You raised 1.3 million. It was like a company in the health tech space. And you actually were driving like real patient outcomes. I mean, things were working in a sense in terms of what the product's supposed to do. But ultimately you have to wrap it up and you can describe it as, let's say, a failed experiment, just like my old startup. I guess, you mentioned you had 7 reasons that you went through as you kind of thought through what happened as to why it didn't work. So we're going to go through that. But maybe as a starting point, like tell us a bit more about what Healthiby was and kind of why you started it in the first place.
So Healthiby was a peer-powered, incentives-driven behavior change solution that enabled people to measurably improve their health outcomes. And when I say people, I'm talking about people who are at risk of or diagnosed with type 2 diabetes, hypertension, or high cholesterol. So those are the cardiometabolic conditions that are very prevalent in the US. So it's estimated that about 60% of Americans have chronic conditions. That figure has been around a while, so I'm sure it's higher at this point. But these are also really costly conditions for individuals who have them, for their employers, for insurance companies, for our healthcare system. And so we set out to really solve both the problem of our health, how we can improve our health through lifestyle and behavior change, as well as this financial problem. It's, like I said, it's at multiple levels too. And so we utilized a combination of health sciences, social behavioral sciences, and behavioral economics to design our really comprehensive, robust solution to help people do this. And so I could go on about behavior change all day, probably.
How did you get into this space? I mean, I think the fact that there's a lot of chronic problems is let's say like well known. Why did you decide to dive into this area?
Yeah, so I had just started consulting entrepreneurs after my first startup, and I connected with a physician who initially just wanted some feedback on his pitch deck, and that snowballed, and it became me working part-time with him for 9 months, almost a year, as a consultant to do market research and competitive research and understand the legal regulatory context, as well as identify early customers and build out an MVP. And what actually became really apparent in the first few weeks is that what he was setting out to do was to improve health outcomes by financially rewarding people for doing that. That was a simple concept. And his story actually was that he would have patients come in, and it would not be for these particular conditions. They were just the most common ones. And they would talk about going to the casinos. They would talk about going to sporting games and, betting and, all this stuff. But eating healthy, exercising, those were nearly impossible things to do. And so he thought, why can't we make this as fun as, betting on, a game or whatever it is that people do enjoy doing.
And where was the money supposed to come from? Like insurance companies, or who was supposed to fund it?
Yeah, so that was what we were trying to figure out. He had this idea that it would be employers at first, and we did explore that space. He also, when we connected, he had a company in mind where he had relationships, and when we looked at that space, there were a lot of wellness solutions, doing different things around, diet and exercise, but nobody was really focused on improving health outcomes in a measurable way and also tying money to it. So we saw a really big opportunity to take this more evidence-based or more clinical. It wasn't a more clinical approach, but a science-based approach to this employer wellness space. And what it turned out is that there were too many legal issues or even perceptions of legal issues with employers incentivizing their employees to not have diabetes anymore. And so we looked at a bunch of things, but just even the perception of it was adding too much friction to us being able to go down that route. So what we ended up doing is midway through developing the MVP and having all this kind of employer focus, we pivoted to B2C, and we decided our goal would be to just prove that we can measurably prove these health outcomes. And we had like low financial rewards, from, both bootstrapped. He put in some money and some angel investment and just do that.
So you just
show
wanted
those
to see
outcomes
if that
and
was a
then-
real thing. Like you guys would fund it. You would fund the rewards yourself just to see if that would actually drive real behavior changes.
Exactly, because that was one of the things we were told, that's going to be too hard.
And how do you get how do you go out and get the initial patients to sign up? Like how much money are you offering? Like what's the draw for people to decide, okay, a lot of people are thinking about dieting, but to choose doing it through you.
Right. So in the early days, I was living in Texas at the time in Houston. And so I went out looking for partners who already had populations of people who were at risk of or diagnosed with these conditions. Well, actually, we initially focused on type 2 diabetes. We added in other conditions later. And so in the early days, Walmart pharmacies, local clinics. And then we also started focusing on Facebook once we had outcomes and very compelling participant stories.
So what would you do? Like take me like Walmart, like you partner with them, or what would you do with Walmart?
Yeah, it started out very, I would say, unofficially. Like we didn't have a corporate contract with Walmart, but they were doing these quarterly wellness events. So they would set up a stand and do hemoglobin A1C tests, blood pressure tests. I think, their pharmacists would offer some advice, and maybe give away some free things. And what ended up happening is I developed a relationship with a pharmacist who was he was, I think, the head pharmacist at one store, and then he became a regional manager. And he just really loved what we were doing. And what's great about pharmacists is they develop a relationship with people when they're picking up their prescriptions, and they have more time in a sense than providers. And so they also it was interesting to me. They really cared to get good information to people about healthy eating choices and different programs. So we ended up going with them, going to some of their events. We sponsored some of the hemoglobin A1C testing, and we'd promote what we were doing, and initially signed up a small cohort and just kind of went from there.
And then how did it work? So you're going to let's say Walmart pharmacy events, a few other places to find these patients, and they're like, okay, cool, I want to do this. What is the experience afterwards?
Our program evolved over time because we took this very experimental approach. The very first cohort we had, we did not have what I would call a program. We had a dietitian, and we initially thought we could host quote unquote sessions over WhatsApp. And that didn't work. We realized people need more engagement. Engagement is really important, building relationships, supportive, as well as collaborative and competitive. And so then we moved to Zoom. And basically, I had done a lot of research, and I ultimately ended up synthesizing findings from hundreds of different studies and guidelines, best practices to create the content. But I would create the content, kind of in the week before a session, and then train the dietitian on how to deliver it. And the dietitian, she comes in with her own knowledge, right? But dietitians aren't trained on engaging people in a cohort virtually or necessarily these chronic conditions. So our initial dietitian, she had really little experience with people who had these conditions and what their challenges were. So anyways, we, did these kind of, I'd say sessions that we were building the plane while we were flying it, right? And we would get feedback. I would sit in on the sessions and I would see how people were responding, and we would adjust based on what was working, what wasn't. We were getting their so in our MVP, because we designed it to be HIPAA conformant, it had good privacy and security from the beginning. People would share their weight and other progress along the way, and we would use all of that to iteratively improve. And so eventually what we had was this series of programs. I say series of programs because there's like core information that's behind it that's all the same, but one program was CDC approved and for people who had prediabetes. And then another program was for Spanish speakers who, were managing chronic conditions. And another one was for, just type 2 diabetes. So we had these programs and we had it supported by our TAC, which was a participant product that enabled people, like really incentivized people with 20 healthy actions that were all associated with healthy bucks and healthy cents. So they would be rewarded with this virtual money for both individual and group achievements. And then, we were collecting data both what I would call manually and automatically. So, we had integrations with things like, fitness trackers, and then manual would be like they were uploading, a photo of their meal.
Those are like rewards. They could be exchanged for like cash or prizes later.
Yeah. So I think the thing that's interesting about it is that most people didn't realize, I've never talked about it, is that while we had this, incentive system that was participant facing. And so they could see, okay, I get a healthy vet for this, healthy sense for that. And then this is what my ultimate payout will be by the end of a program, right? What we had also done is we had made some intentional decisions early on that we want this to be sustainable over time. So this is one of the reasons why we ended up developing a lot of relationships in the life insurance space and talking to a lot of life insurers about building a 401k for your health. Because in our back end, the way that it was developed, these programs, while they eventually became 4-month and 12-month programs in the healthcare space, it could have been 20 to 30 year programs where you're building up an account essentially, right? Like maybe you're earning a few $100s a year, and then over 10 or 20 years, you've got tens of thousands of dollars in healthy bucks. And, that's reducing the cost of your life insurance. There's various ways that it would have paid out. But anyways, the idea was that it wasn't just going to be a reward for the medium to near term.
Got it. Okay. So that all makes sense. Then let's get to the reasons. Like you mentioned, you had 7 reasons why ultimately it didn't work out. It did work in the sense that you were driving outcomes, so that wasn't it. But what are some of those 7 reasons why the company ultimately failed, as you said?
Shifting budget priorities were a big problem. And in this particular situation, it became more problematic that an investor who made a verbal commitment to invest in Healthiby, and also specifically any commercial pilots that we closed, this investor insisted on speaking with the CEO, and we had a meeting, and it was turned into this whole circus that I've actually never seen before. He ended up pressuring the CEO in a way that I really never would have wanted him to be pressured. And I think, pressuring an executive who already has budget issues that he's trying to resolve, I just don't think is a good strategy. And unfortunately, it's the one that the investor took, and the investor then backed out because he didn't successfully pressure the CEO into paying in advance.
What are some of the other reasons on the list?
Okay, so behavior change. While we're a behavior change solution, there are behavior changes that have to happen at multiple levels, like in the systems we're in. So my perhaps controversial take, I don't know if this is controversial or not, is that innovation in companies, and I believe this is true for all size companies, but especially enterprise companies, fundamentally it's behavior change. Now, there's exceptions when it's like ambient technology in healthcare and it's just listening and you don't have to do anything. But if there are end users involved and there's innovation, you need people willing, ready, and able to change behaviors. And so there are just too many different, I think, systems involved. So the healthcare system is one, but also there's another story about, I guess I would call it behavior change and venture capital, which I think only can be facilitated by a policy intervention. So that's a whole other conversation. But anyways, those things we didn't set out to address, but they had significant impact on our trajectory.
Macro changing is also a real thing. Enterprise sales cycles, shifting priorities is a real problem. But what about the fundamental piece of, the core business?
Well, okay, the core business, I actually don't think there was anything wrong with our core business. No, there's nothing what I can tell you is sales. So we know sales cycles in healthcare are long. Bessemer Capital says like 12 to 24 months, but I think that was a pre-COVID estimate. So I don't really know what the estimate is now. Like combined with that, on a personal level, I'm someone who likes to solve problems, and that's what I prioritized more than sales. We didn't have somebody who just loved sales and was just...
Because this would have been sales to who?
It would have been sales to health systems, payers.
That's part of the equation that I'm trying to dig into. Like,
Yeah.
fundamentally, yes, you need people to use the thing and make changes. But there's no dollars and cents there. Like, you know what I mean? Like, who's actually paying you as a customer is not the patient, right? It's whoever's funding the bucks and all this stuff. So that's the part of the equation that I'm still super unclear on, is like, okay, the patient gets value if they change their behavior. Great, but they're not paying. So who would be paying when you say sales? That's why I'm asking, like, who would actually be paying to fund this thing and therefore get value? And is that part of the thing that never found a true loop where somebody was willing to pay for somebody else to get healthy and then they would get value as a result indirectly?
Yeah. So, okay, I'm just going to bring up some things so that you can see this as I'm talking about it. So you've probably heard from entrepreneurs in healthcare that it's complicated. There's revenue cycle issues. That is another real issue. But in our case, what we were doing is we were approaching companies about both fee-for-service and value-based care models. And the reason I say that is in a value-based care like Medicare, we would be paid based on outcomes and lives, whereas in fee-for-service, you're paid. So we had so there's different codes, right, that systems get reimbursed for. We didn't go down the path of becoming a provider ourselves, and that's another conversation. But we had all these different codes that we could be reimbursed on, and the issue wasn't,
for example, Medicare. Is that right?
Well, it could be a health system that has a population of Medicare patients.
Okay, that makes sense.
It's not that they weren't interested or even willing. Where we did have problems is a couple times where people say, oh, talk to our, I don't even remember the title, like, revenue cycle. We couldn't even get to the people who had answers about how long it would take to get reimbursement, what they expected the hurdles to be. So what ended up happening is because so many providers have issues with reimbursements, there was just so much friction and hesitancy because doing anything new is a cost and risk for them in terms of reimbursement.
Got it. Okay. That's super helpful. I ask you as a final question, like, having been through this experience and now, like you said, you're a venture partner you used to, and I'm sure you still do, work with a lot of other startups. Like, what's maybe your biggest piece of advice for early stage founders, that are in that 0 to 1 phase?
So my biggest pieces of advice, besides what I've already said a couple times about the venture, is really understanding the systems and the workflows. So nowadays in 2025, it's common to hear people say that EHR workflows are terrible for providers and, it's just highly problematic for adopting new technologies or integrating with new technologies. So that's commonly known. But at the time, I would just anecdotally hear these stories. And I think, I would get feedback that our clinician platform was great. We collected longitudinal behavioral and biometric data that some providers would say, oh, this is how our EHR should be collecting, displaying data. Like we should be able to access this type of information, but we're years away from it. Like I took it as, okay, it's positive feedback. We're a little ahead of the curve. I didn't fully appreciate the extent that these current workflows and EHR issues inhibited our ability to really get in the door. And then, something that I didn't do as a founder that I should have done is figure out a way to tell my story better. So I do have a personal story that I eventually started sharing that I had to make very significant behavioral changes myself in the years leading up to Healthiby because I had been diagnosed with Crohn's disease and I was told there was basically no hope. It gets progressively worse, and I could take some pills that are 50% effective if you're lucky. I opted out of the medications and kind of went on this journey to make both dietary and lifestyle changes. And it took me years, but I did it, and it was healthy. I no longer have any sign of Crohn's, according to
Wow,
physicians.
congrats.
So yeah, thanks. And so I know the journey, right? And I know how unhelpful actually healthcare can be in that process. And so I did start to tell that a bit because that's why I was also so convinced about what we were doing. It wasn't just the science and it wasn't just, the numbers. It's like, I've lived this. There's more to my story and I still haven't really figured out how to tell it. And so because I've over the years seen founders who tell really difficult stories well, I wish I had invested more time in doing that.
Got it. Well, that makes total sense. Mary Beth, thanks so much for sharing your story. It's been great.
Yeah, well, thanks. And okay, one more thing I won't say to founders because I've been there. In your early days where you're really excited about solving the problem and you have all these solutions in mind, it's easy to discount people who tell you, what about this? Or especially from a founder. So over the past year, especially, I've met with first-time new founders, and I said, "Well, what about this?" And they're, no. And I think it's really important for founders to at least hear the advice from other founders who've been further down the road. And even if you don't take their advice in that moment, 6, 12, 24 months later, you may really appreciate what they learned the hard way.
So picture this. It's months from now, years from now, and one of your founder friends, or really close founder friends of yours, guess what? Their startup went bankrupt. And it turns out if you had just shared the product market fit show with them, they would have learned everything they needed to find product market fit and to create a huge success. But instead, their startup has completely failed. You have blood on your hands. Don't let that happen. You don't want to live like that. It is terrible. So do what you need to do. Tell them about the show. Send it to them. Put it on WhatsApp. Put it on Slack. Put it where you need to put it. Just make sure they know about it and they check it out.